Today let's talk about how do we do dental bleaching or teeth whitening in the clinic on the patient. Hi everyone, my name is Dr. Monica Gupta. I am a dental healthcare professional. So come on, let's understand the procedure step by step in detail on the patient. Also, I have divided this video in 3 sections. First is material required for the procedure, second is patient preparation, and third is procedure of the bleaching.
So let's prepare a tray for the materials required in the procedure. We need bleaching kit, mixing pad and spatula, small cotton balls to clean interdental areas, big cotton balls to remove bleaching material from the teeth, cotton rolls under the lips and tongue, suction tips, cheek retractor, Vaseline to apply on and under the lips, vitamin E capsule to apply on the area where bleaching gels falls unwantingly, earbuds to remove excess material, polishing paste and rubber cup, contra-angle handpiece, eye shield for patient and the doctor, curing light, and patient tray. Always take the pre-pictures of the patient. Ask the patient to wear the eye cover. Do scaling and start polishing of teeth with polishing paste to remove any biofilm from the teeth, followed by scaling in interdental areas. You can also use pumice instead of the polishing paste. Wipe off the material properly and dry the teeth with the small cotton balls from the interdental area. Now apply the cotton rolls under the lips and the tongue. Start applying Vaseline on lips and gums, both upper and lower teeth, and place the cheek retractor. Now apply the gingival barrier thick layer in this manner from canine to canine in upper and lower gums both, and cure it with curing light for 10 to 20 seconds. Now open the 2 powder pots and 2 H2O2 liquid bottles and mix them well with a plastic spatula inside the powder pot to make a thick viscous gel. You can mix these two on a mixing pad by using a plastic spatula. Now either you can load this viscous gel into a syringe and apply it using a syringe on the teeth, or either you can apply it directly using the 2 micro brushes provided in the kit. Leave the gel for 10 to 15 minutes. Use suction tip in between to aspirate the saliva. Now remove the paste from teeth with big cotton balls from all surfaces properly. We need to apply this paste 2 to 3 times. Now we are applying the second round of the paste on the teeth using the micro brushes. Removing the paste after 10 minutes, and then repeat the same process for the third time. Remember to use the mixed paste within 30 to 40 minutes after mixing. After the last application, suction all gel, wash them with 3-way syringe and clean properly. Now remove the gingival barrier by lifting it from the end. Do apply vitamin E capsule gel with earbuds on the blanched area of the gums where bleaching gels paste might have contacted. And now we are done with the procedure. Do take the post pictures of the patient.
So I hope you enjoyed watching the video and got an idea how to perform the bleaching procedure on the patient. Do comment down and share your experiences about dental bleaching. Subscribe our channel for such informative videos. See you soon. Stay healthy and bye-bye.